You're effectively killing who you are just to keep this secret.
She doesn't love me.
This move I did not expect. So I suppose the next step is for me to talk to the DA.
Which you have no intention of doing.
No.
You son of a bitch!
People like you, even your actions lie.
When someone treats you the way that Tritter just treated House, the natural response is rage. Very excited to be reacting to House MD Season 3 Episode 11 Words and Deeds. On this channel we are reacting to all 177 House videos. This will be episode 73. Let's see if I can get the diagnosis before House does as a doctor working in London.
What the hell do you two think you were doing? You never go in without authorization. Go ahead, the paramedics look you over.
A frozen fireman? What are we going to have next? A drowning coast guard? A deported border control officer? A drug addicted doctor? Oh wait. Derek, our fireman, had some breathlessness, spacing out, and loss of awareness while walking. What could that be? It's not consistent with any kind of seizure, as even though they do make you lose awareness, you don't start zombie walking like this guy. It could be some kind of sleepwalk though, especially triggered by a stressful event, like having to pay rent, or having just walked out of a burning building. That's way too boring for House though. What could be spicier? Well, narcolepsy can cause people to suddenly fall asleep during the day. In type 1, they lose muscle tone and collapse like teenage girls when they see Chase. In type 2 though, the patient could fall asleep and still maintain their muscle tone better than your husband on Viagra. Either way, we need more clues.
Your temperature's been going up and down like a roller coaster. How old are these skin grafts?
Last one was about 6 months ago.
And we'll get a consult with Dr. House.
Not guilty.
Preliminary hearing is set for the 19th at 10 a.m.
You need to talk to Tritter.
You are not impressing anyone. You used the rectal thermometer on him. You flaunted your drug use in his face.
I accepted the deal.
Not until after you stole a dead guy's pills.
Talk to him.
So this Mercer thing, would it make everything look blue?
Oh, a lot to go through here. 6 months before this, the patient had 3rd-degree burns on more than 50% of his body and was in hospital for a while because of it. He got them trying to save his partner, Amy. The team are now wondering if he got an infection from that hospital stay, which is affecting him now. That wouldn't quite make sense though, as the hospital superbugs wouldn't be so super if it took them 6 months to actually infect their host to cause symptoms. So what are his symptoms? Well, he has swinging fevers, that vacant episode which may have just been him mistaking a burning building for a campfire, and the previous skin grafts. Swinging fevers typically are associated with abscesses that are deep-seated pus balls in your body that get walled off but are filled with infection. They don't cause blue vision though. What could that be? Well, blue vision is actually called cyanopsia, where everything in your vision starts to take on blue hues. The most common cause in someone of this age group would actually be Viagra, the generic name of which is sildenafil. Taking that drug can sensitize the rod cells in the eye, which sense light at blue-green wavelengths, giving the visual field that blue tinge. So maybe our man's had a bit too much fun at the blue light district recently. Let's find out.
So maybe it's menopause. Male menopause.
Doesn't explain the blue vision.
Blue vision isn't a symptom, it's a side effect of Viagra.
Burns to his genitals could cause testicular trauma.
Run a hormone panel. Comes back positive, pump it full of testosterone and send him home.
He okay?
Stop.
No, just take him out.
You gotta calm down. It's
No,
okay.
get him out! Get him out!
I know it's not the patient's fault here and he had no control over his actions, he's unwell, but violence against healthcare professionals is a huge problem. Just recently when I was on palliative medicine, I was called to a room as one of my healthcare assistant colleagues was trying to take a 72-year-old man a cup of tea and was punched in the face. I wish that were the only occasion as well, but sadly it isn't. At least 40% of healthcare professionals have experienced violence in the workplace. The most common demographic to be affected is female staff, with male patients as the perpetrators. The risks are way higher in some specialties like in psychiatry, where staff are 10 times more likely to be assaulted. Long-term nursing and residential facilities also have a 75% higher risk of being attacked than in hospitals. The numbers here are likely even an underestimation, as based on my time in hospital, many nurses see small physical attacks as part of the job that they just handle. It is not normal to be worried about being attacked when you go to your job and not feel safe in your workplace. We need to report these incidents even if they aren't the patient's fault, because it's a total management failure if a hospital can't appropriately protect the people that keep its wheels turning. So question for you smart people, how would you stop patients attacking healthcare professionals? Answers down below.
I'm sorry. You could throw a dart at all the adjectives between arrogant and unhinged, and I'm sure you'd hit one that describes me.
Thank you. Even if you don't mean a word of it. I'll see you at the hearing.
Contamination and allergy tests both came back negative.
There was nothing to suggest a pulmonary embolism.
Aggression comes on that fast, it's gotta have a neurologic basis. We should do a CT for a frontal lobe tumor and an LP for meningitis. Great.
House really dug deep to pull out that apology. He had to tear apart his pride, and then Tritter responded to the outstretched hand with a machine gun. Now he's in House's head, making him wonder if he even meant the apology at all, or if it was just a desperate attempt at redemption. This is exactly the kind of dynamic you can get in an abusive relationship, and we call it gaslighting. The abuser gets the abused to question their own perception of truth and make them feel deserving of the treatment. Of course, House has done some bad things, but does that mean he's such a sociopath that he would be able to lie to such an extent to fool himself? I don't think so, but it's something he's now considering. Either way, his brain space is so far from the case that Musk might pick it up when he lands on Mars. Foreman isn't quite right about sudden aggression indicating neurological like that though. Usually true neurological conditions are quite slowly progressive, like Parkinson's disease or Alzheimer's. Now vascular conditions like strokes that affect the brain because of a clot or a bleed can be sudden, and they could just disappear if the patient had what we call a transient ischemic attack. That reminds me of a case I actually saw today. 20-year-old male who suddenly lost control of his right arm. He thought it wasn't anything to worry about, but went to A&E to get checked out anyway. When he realized there was a 5-hour wait, he just left and came to see me 2 days later. He still had right hand weakness at that point, although it had improved slightly. I was very concerned that he had had a stroke even at such a young age, and decided to send him back to A&E to have a head scan. Still waiting on the results. It seems like we've ruled out the male menopause for now though, so I think transient ischemic attack is the most likely here. If the attacks get worse, then they can affect the patient's words and deeds as well, which is the title of the episode. So transient ischemic attacks are my first diagnostic guess.
Where are you going?
Upstairs this time.
To do what?
Check myself into rehab.
CT was normal, no frontal lobe tumor, LP was negative for meningitis. We're back to square one.
How about you, Greg? Thought about how to fix things with people in your life?
No need. People in my life have no expectations of me.
House checked himself into rehab. What's gonna happen the next episode? Billionaires pay tax. Kim Jong-un joins sensitivity training. The EU welcomes Britain back with open arms. In the UK, inpatient rehab like this though is all privately funded. If you want to stay at home in your own environment with your old friends, old habits and old supplies, then sure, we can provide you NHS services. They are actually effective, but not quite as much as inpatient rehab. Being in a totally new place and cut off from the usual stimuli helps to start a new routine. You've probably heard of international best-selling book Atomic Habits by James Clear, and in it he says there are 4 ways to eliminate bad habits. So make it out of sight, make it unattractive, make it difficult, and make it unsatisfying. Rehab in an actual unit fulfills all those criteria as you see what the drugs have done to other people. Drugs aren't easily accessible, replacement meds are there to manage cravings. Also, since the patient's new social circle are anti-drug, then it's easy for them to adopt that stance as well. As long as they're open-minded, of course, which I'm not quite sure House is. If you're open-minded to even more House though, then check out the channel membership. You get early access to new videos, priority reply to comments, and to suggest a series and episode for me to react to. The first 30 members have a chance to win a 1-hour one-on-one tutor session with me on a topic of your choice. We currently have 27 members with just 3 spots left, so press join now to secure your spot. The earlier you join, the earlier I can react to your suggestion, so press join now.
If you could do this on your own, I assume you wouldn't be here.
True.
Everybody lies. He's toxic green.
It's been clean every time.
Exactly. This guy's worried about losing his job, so he's hiding the pain.
157, respiration 42.
He was fine. He was just telling me a joke.
He's got marked ST elevation. He's having a heart attack.
ST elevation is an incredibly dangerous sign. It means that there's likely a full blockage in one of the coronary arteries that supply the heart. With patients like this, there is a time limit to get them to what we call the cath lab. That's where the cardiologists thread a wire up from the wrist into the heart and inject a dye to see where the blockage is. In most cases, they can inflate a balloon there to allow blood to start flowing again and or put a stent in to keep it open. If that doesn't work, then you're in serious trouble. Like once when I was on cardiothoracics and a cardiologist actually punctured one of the coronary arteries with the catheter, we had to take the patient to open heart surgery immediately to find and repair the rupture and do a heart bypass operation. So what is bypass surgery? Well, it's exactly what it sounds like. We grab a vein from inside the leg or use an artery in the chest to allow blood flow from the heart to bypass the blockages in the coronary artery. That allows new blood flow to come back. It's very technical surgery as these are quite small vessels and even the smallest error in suturing them can lead to catastrophic consequences. Despite that though, some surgeons can actually do the procedure with the heart beating. It's like trying to play golf, but the hole is as stationary as a hamster on meth. The fact the heart is affected now as well does make vasculitis a bit more likely, but also genetic high cholesterol could explain the mini strokes and heart attacks. Need more clues for sure.
His blood tests show troponins and CKMB up. He's been having a whole series of heart attacks.
What caused the attacks? Maybe we should go.
Whoever came up with buprenorphine to wean off Vicodin should be shot. The cause of the heart attacks isn't internal. It must be external, something environmental.
His partner, Amy, was at all 3 attacks. Would you come with me, please?
What's this all about? This was right.
How can I be causing his heart attacks?
This man is having heart attacks because his partner Amy gets close to him. What on earth? The fact they only realized this after they got to the hospital means that their sex life is about as active as the Titanic. To really get academic about this though, we'd want to know what is it about Amy that's triggering these heart attacks? Is it her clothes? Is it her hair? Something on her body itself? You'd want to separate things out as best as you can and test each for strange chemical traces, or just do it the house way and throw them all at him separately and see which one sends an invite to her house's close enemy. Mr. G. Reaper. No, the first name isn't Greg. There are some things we can infer though from what we know already. The reaction he had was almost instant after she walked in, which indicates it could be an allergy, vascular or psychosomatic. Now when they check his cardiac vessels, they all seem to be clear, which means that whatever's causing these episodes isn't a clot or gradual narrowing. That's actually given me an idea. Prinzmetal angina, which is my second diagnostic guess. You see, if there's one thing that partners can bring without fail, it's stress. Guess what triggers Prinzmetal angina? I'll give you a clue. It's not sunshine, rainbows and unicorns thrusting. It's stress that triggers the vessels in the heart to spasm and narrow, blocking the blood flow to the heart temporarily until the trigger is eliminated. Usually that triggers something like cocaine, but who needs Charlie when you can have Amy? Now I bet they'll search her clothes for plutonium and anthrax and find the problem was staring them in the face all along. Monogamy.
You're a coward, House. You find fault in everybody because you're afraid to look at yourself.
We tested Amy for about a dozen different agents, but they all came back negative. Are you in love with her?
She has a 6-year-old daughter.
Women with daughters can still fall in love.
I know. With my brother. They're engaged.
Broken heart syndrome.
But short of frying his brain and wiping Amy out, he's screwed.
The guy's heart isn't working, and you want to shock his brain.
And results, no memories, no Amy, no problem.
Go ahead.
I thought he was with Amy! This is why vague status terminology is confusing. They said she was his partner, but for firefighting, not baby making. She's actually with his brother, and that's so painful for Derek to see and be reminded of that it's triggering broken heart syndrome. That is totally different to Prinzmetal angina, which I mentioned earlier, but is still triggered by emotional stress through a different mechanism. A heightened emotional experience like losing all your money on a bet, losing a loved one, or even winning the lottery can cause a massive release of hormones which stress the heart and cause damage to the muscle. The official term is Takotsubo's cardiomyopathy, but it's also known as broken heart syndrome. Generally, Patients with this condition do improve over time, but the team don't have time apparently. So rather than waiting, they're deciding to take cooking classes with his brain by using electrodes to shock away his memory of Amy and everything he ever loved. Explaining it like that doesn't quite sell it though, so instead it's called electroconvulsive therapy. The truth is though, ECT wouldn't wipe your memory completely like that, but let's go with it for now. One of the first experiments that gave birth to the idea of that therapy was done in the 1920s and was called deep sleep therapy. They essentially put schizophrenics to sleep for 5 to 11 days using very strong sedatives called barbiturates. These are actually used in euthanasia and lethal injections to this day, but in lower doses which are safe as anesthetics. After this mammoth snooze, many of the patients woke up with better symptoms, well, the ones that made it. That's where the idea that resetting the brain could be helpful came from, and scientists tried pretty catastrophic alternatives like insulin shock therapy to try and do that, which thankfully haven't survived to the modern day. They also tried resetting the brain using a drug called metrazole to induce seizures, but some patients had convulsions so bad that they were at risk of fracturing their spines. It wasn't until an Italian doctor named Ugo Serletti saw pigs being anesthetized with electricity before getting slaughtered that he thought to use that on humans. Even though it initially did have some side effects like slight memory loss, confusion and tiredness, patients actually felt much better on it. Benefits were improved even more when patients began getting sedated for the procedure and 1 electrode was used instead of 2. So question for you smart people, would you personally be able to press the shock button to administer electroconvulsive therapy? Answers down below.
You're effectively killing who you are just to keep this secret.
She doesn't love me.
This move I did not expect. So I suppose the next step is for me to talk to the DA.
Which you have no intention of doing.
No.
You son of a bitch.
People like you, even your actions lie.
When someone treats you the way that Tritter just treated House, the natural response is rage. You may even want to punch that person to get even with them, put them into disrepute and get revenge. It fills your thoughts and you start blaming that person for your new situation that you're in. Before you know it, that person has gained control of your entire life without even being there. That control wasn't forced either, it was handed willingly as we chose to make our life enemy-centric. This is exactly what Dr. Stephen Covey talks about in his legendary book, The 7 Habits of Highly Effective People. In it, he says that some people become so centered on an enemy, so totally obsessed with the behavior of another person, that they become blind to everything except their desire for that person to lose, even if it means losing themselves. Instead of being enemy-centered, friend-centered, career-centered, or even family-centered, be principle-centered. It gives you the power to become a self-aware, knowledgeable, and proactive person that can grow to the point that your old enemy becomes irrelevant. It was actually the first personal development book that I read, and it helped me to take the steps to start this YouTube channel back in 2016. You can get the 7 Habits of Highly Effective People with a free trial of Audible Premium Plus. The link is in the description below. Following that link and signing up to the trial also helps to support the channel, so thank you very much for doing that.
I'm scared.
I'm gonna give you a muscle relaxant so your body doesn't convulse. What's your name?
Derek.
I'm Amy. I'm your friend.
But I don't remember either of you.
I got you something.
Nice.
I figured it might help make a good impression on the judge.
It's not that nice.
Hey, if my tie isn't that nice, sorry, your tie, then why do you keep using it? First, the student in 3 stories, then burglar, now House. Clearly, I was made to react to this show. I actually bought this before I was even a doctor. With our patient though, seems like he's cured. It was actually broken heart syndrome. Pretty crazy that they decided to wipe his memory to fix it. Question though, assuming ECT could be a hard reset, if he was so psychologically prone to it before his brain was wiped, what's stopping him from falling in love with Amy all over again? Especially now he's staying with his brother after the rehab. I guess it depends though how much of the attraction was physical and how much was actually emotional and personality based. Surely every attraction has at least some physical basis. That's what gets him to even consider her personality in the first place. That may sound somewhat harsh, but in a world of 7 billion people, you can't fall in love with everyone, so how can you screen? Is it the person's appearance, their culture, their race? What is it about Amy that tied his stomach in knots and made his heart look like a SpaceX landing? Maybe we'll never find out, but what we will find out is even more interesting: what happens in House's hearing.
I know the timing isn't great with a wedding coming up. You and Brock.
We're not getting married. We don't even date.
Thought I told you never to call me when I'm on trial.
The memories were false. We fried his brain for nothing.
Dr. House, hang up.
Does your voice always get that high and annoying when you're angry? There's nothing I can say or do that's gonna make a difference here. His voice isn't high because of the electrical charges. It's another symptom of menopause.
Did House just leave the court in the middle of the trial? I bet that's gonna work in his favor. Maybe the judge will see that he's just an arrogant genius in pain that is bound to make a lot of enemies. What's more likely is they drag him back by the trousers and tie him to the chair with a slinky. What's very interesting here though is I've only used 2 diagnostic guesses and it seems like we are back in action. The team keep mentioning the male menopause, which is pretty misleading in itself as it implies that there's a sudden drop in testosterone, which just isn't the case. Sorry to tell you guys, but testosterone levels drop by around 1% a year from 30 to 40, which doesn't cause problems usually in itself. The symptoms of the male menopause though are depression, loss of sex drive, erectile dysfunction, mood swings, and even gynecomastia or man boobs. Some people even call it a midlife crisis, but these aren't because of hormones. A lack of sleep, poor diet, lack of exercise, or getting a bit too spicy on the booze could all cause it. Believe it or not, treatment doesn't include quitting your job and spending your life savings on a 2-seater that you need a loan for just to pay for insurance. It involves stress management techniques, therapy including CBT, and exercise. Right at the start, they mentioned how he was dodging the tox screen. What if he was dealing with his stress and causing his testes to shrivel up like raisins by becoming an alcoholic? It would match the episode's rehab theme and explain all his symptoms, including the inventing memories, which is caused by Korsakoff psychosis and thiamine deficiency. That will be my 3rd and final diagnostic guess.
Ejecting the dye.
There. Spinal meningioma. Pushing on the nerves of the vocal cords. And that nerve just happens to live right near the meningeal branch of the vertebral artery. Obstructs the blood flow to the brain. Scheduling for surgery. Sorry, didn't mean to interrupt.
Does that appear to be Dr. House's signature? Dr. House had no legal or medical basis for acquiring that oxycodone.
He never got the pills. Dr. House only got a bottle with placebos.
Your Honor, she's lying.
I move to dismiss this case.
Dr. House, please stand. My suspicion is you have better friends than you deserve. I'm not going to allow this to proceed to jury. Case dismissed.
What? House 1 must have been the magic tie. If I ever start selling channel merch, this tie will be top of the list. Well, I find it quite interesting that even though they established House thought he was stealing controlled drugs from a dead patient, he was innocent, all because of a technicality that it wasn't actually controlled drugs he was stealing, even though that's what he thought. Seems like in the eyes of the law here, intent mattered more than action, but that's definitely not always the case. Like if a person kills someone and it was intentional, then it's murder and they get a mandatory life sentence. If it was by accident, it's manslaughter and they could walk away with just 2 years. The judge did say that she thinks Tritter had a vendetta against House here as well because of his particular kind of charm. Incredible.
Dr. House, you're still guilty of contempt for that little walkout earlier. You'll be spending the night in jail.
Good luck. I hope I'm wrong about you.
We got the meningioma.
You made me perjure myself. The only bright spot is that now I own your ass.
That's Vicodin. The whole time?
Tritter was right! Even though House was in rehab, he was being slipped and smuggling in Vicodin the whole time. That's more common than you might think, and in mandatory rehab facilities or prisons, then the street value of drugs gets significantly higher. Just in the UK, the prison drug market is worth £100 million, with almost 200 kilos of drugs being confiscated every year. The prison staff that work there are generally not paid very well, but the unofficial workplace perk could make it worth it for them. Like the chef named Bongo Williams, who was jailed a couple of years ago after being found selling powdered cannabis in prisons. The issues that drugs cause in prisons can be magnified from the outside world, causing debt, power imbalances, and violence. Really entertaining episode of House. 8.5 out of 10 entertainment, 4 out of 10 accuracy for the whole memory wiping part, 6 out of 10 diagnosis. This doesn't make full sense though unless you watch the previous one where House solves a girl with dwarfism. Here,